This is the Neuroflex Restorative Flex Boot. I call this the Cadillac of our boots because for the very, very severe contractures, it is the boot. Now, it's fine for mild contractures too, but if you have very severe plantar flexion, ankle contractures, inversion or eversion, this is the boot you want to go to. It has the strapping and pads that are vital to be able to cinch the patient's foot onto the boot to allow it to do its flex technology to reduce that tone and spasticity and then re-lengthen shortened tissue. It's also the one I would choose for people with diabetes because it has this tongue that gives extra protection over the toes. It prevents shearing pressure from sheets and bedspreads, and also if they're up in a chair, it prevents someone from hitting their toes and causing damage, or if they're taking steps, they don't want to hit their toes on something they might walk into. I might mention too, it's very good for other things besides contractures. All of our boots do a wonderful job with plantar fasciitis, which is a very painful condition. These flex straps are great to put tension to bring that foot up into dorsiflexion, and that's what you need to resolve the pain that you have with plantar fasciitis. You'll see we also do all our boots in pediatric versions. We start at a 3-inch foot. This is a small child, but we want to start with them as soon as they begin to develop tone, which can be while they're still in the neonatal intensive care unit. But certainly kids are diagnosed with cerebral palsy from birth up to maybe 2 years and sometimes longer. Has a little non-skid sole that you can take off when they're in bed, and it has the same features of our adult boots. I will say these go up incrementally from 3 inches to 8-inch foot. This is not a shoe size, it's an 8-inch foot. That's much easier for you to determine the size of boot for your patient because men and women's sizes are differently, and these are all for male and female. But the 8-inch boot in this is more narrow than our adult boots. Our adult boots are small up to 8 inches, medium up to 9.5, large up to 11, and extra large up to 13 inches, and then anything over that you need to just request it. We'll make whatever size you need. But the 8-inch boot in the adult will be a little wider than the 8-inch boot in the pediatric version. So if you have a patient with up to an 8-inch foot, it doesn't matter their age. If it's more narrow, then I would order the pediatric 8-inch boot. The Flex Boot, the plastic, now this one has been remolded, and this is the shape of many of our patients, not just in nursing homes but living at home too, and certainly children with cerebral palsy, shaken baby syndrome, whatever type of brain or spinal cord injury they may have. It could be patients with neuroblastoma, with different cancers. Sometimes we don't think about those developing neurological conditions and deformities, but they do. It's whatever causes a problem with the nerves of the central nervous system, brain, spinal cord, and then out. So it's vital that we make the patient's the splint fit the patient's foot. We don't try to make the patient fit the boot. You cannot take a contracture patient that now if it's flaccid foot drop, yes, you don't have to mold the boot. If you can bring them, let's say they're flaccid after a stroke, you can bring them up to 90 degrees. That's wonderful. If they're a bed patient and you're preventing a foot drop, you don't have to remold the boot. But if I can't bring their foot up within 15, 20 degrees at the most, but my rule of thumb is 15 degrees of normal, I'm going to remold this boot. By doing that, you're able to cinch their foot down. You have to hold them on the boots so they can do, see that flex technology? That fishing pole type of push in with tension and come back. This way you cinch them on. If you don't remold the boot, yes, it will go down, but you may scoot a little. So in order to hold them secure, we're going to remold it down right here. To get instructions on how to remold the boot, just go to the restorativemedical.com website, click on products, then on the Flex Boot, and at the bottom of that final page you will see the videos. Also, if your toes are firing down an extensor tone, you want to mold those down. You don't want the toes rubbing, and they will. If you mold it down, it's just like the hand splints. They'll be able to push in with that tone and spasticity, and then in about 15 minutes, maybe sooner, you should see a relaxation. You can't shove these people into correction. It will cause them needless pain. You can actually kick in the stretch reflex, which if you push too hard, too fast, they'll end up back here. So it's very counterproductive, and it could actually, if you're too aggressive, can tear muscle. It can tear muscle away from the tendon away from the bone. So we have to be very careful. By allowing them to be cinched on this, you've got all that tone in those little tarsal bones in their foot that can relax right into the boot, and you'll start seeing them we're setting the process for correction. Then we know that, of course, we always go by the 6 weeks of prolonged low-load passive stretch to realign the actin and myosin proteins in the belly of the muscle, in the sarcomere units, to prepare the muscle to be re-lengthened. So again, the being too aggressive with these patients is counterproductive. We have to follow the process. We have to also make sure the caregivers and the patient themselves understand the process, and so they won't think that I've worn this for 2 weeks, or my caregivers put this on me for 2 weeks and it hasn't, I don't see a big difference. If they realize that it's going to be a couple of months before this process is done in their muscle that they can't see, but it's required in order to do this restorative work, then they'll understand that they need to keep putting this on every day, and the longer they wear it, the better it is. Now, I say up to 6 hours at a time. You want to take any of the devices off, check the skin, make sure there are no pressure areas, leave it off an hour, and you can put it back on. It depends on how much time you have, but if we can leave them on up to 6 hours a day, you get that nice stretch for that long, that continuing to reduce the tone and spasticity, perhaps some biofeedback to the brain through the spinal cord, and the prolonged low-load passive stretch to begin to re-lengthen tissue. So it's very simple, it's very easy. The majority of these products are put on by trained orthotic fitters. It's just good common sense. Okay, with the Flex Boot, again, you have the Velcro on, non-skid sole. You want to always make sure it's on when you get your patient out of bed or a chair, because it will keep them from sliding or scooting, slipping when you transfer from bed to chair, chair to commode. Also, you can take a few steps with them. These are not ambulation boots, but you can safely walk from your chair to the commode, that sort of thing, but make sure it's on. Then when you get ready to get in bed, take it off, because what is on the floor needs to stay on the floor. We don't want that in the patient's bed. Okay, to fit the boot initially, especially if you've had to mold it down, then you're going to, these are very adjustable. So this is called the Flex Strap, and it has elastic properties, again, for you to be able to push into that, you know, when your body says, when that muscle says, I have to shorten, then we have to allow them to go through that process. But we want the tension to bring them back and provide just the right tug to cause a relaxation through the central nervous system. Totally different from orthopedic. This is very adjustable. You just put it at whatever height seems to be the best for your patient to give you the appropriate leverage. This is all just 3-point leverage. You're pushing here, here, and bringing the heel back this way to create 90 degrees. Okay, I'm going to undo this strap, put the Velcro back. These are just flaps. This has Velcro, so we're going to push it back. Open it up, and then our Talus Strap, and Velcro it back. Open that boot up, and here's your tongue. Now, you want to, again, set the patient's heel as far into the boot as possible. Then I typically work from, I'm in front of the patient, and I am going to hold their foot down as I crisscross this, and I'm holding them, secure. Oh, it would help if I did the tongue. Always do the tongue first. And you're going to pull it back a little. You don't want any pressure on the toes. But if you can see, this actually allows for so much padding that you can cinch the foot on the boot. So, and not have to worry about pressure. Okay, now I'm going to do the flaps and bring this over secure. And I'll come back and recheck it again in a minute. But I'm going to do a quick run with my finger under that. Then I'm going to, you can do the straps in whatever succession. I like to do this one first because it anchors your foot. You can do the Talus Strap next, or the calf. If you need to secure the patient in, you can go ahead and do the calf. You can do this straight across, or you can also bring it down. If you're really concerned about any potential pressure, you can bring it down like this and crisscross it. Then this strap is actually going over additional layers. So again, it's kind of the degree of contraction of your patient, how far they're down, and how you feel best to take care of them. Then the Talus Strap comes over, and you're going to weave it down. And this is the important part, to hold the patient's foot totally into that heel. You have to do that in order to work on bringing them up in 90 degrees. So we're going to snug that, and once you get the heel on, you're going to put your finger in there and make sure that the heel is suspended and it's not touching any of the plastic. There's padding there, but you don't want it on the plastic. Now, Velcro. Now is when you're going to bring these up. And see, even if you've heat molded it down like this, the flex straps will bring it up. So you may never have to heat mold it again, but you can to bring them farther into correction, whatever makes the most sense. So I'm going to tighten these straps. If my foot is going this direction, I'm going to tighten this strap more to tug it around. The opposite would be true. If it's just going down, then I'm going to make them the same to tug up. But again, you've got that good stretch. The rotator bar, like a kickstand on a bicycle or a motorcycle, comes out either direction. Smooth the padding down when it's not in use. We actually started putting little labels on here because not everybody looked to, they were thinking we didn't have rotator bars, but they're padded because if your patients have one boot on in bed and they're crossing and rubbing, we didn't want that rotator bar to rub on the opposite foot. So again, this is the Neuroflex Restorative Flex Boot.